A new CDC study shows there is no evidence COVID vaccines cause fatal cardiac arrest or other deadly heart disease problems in young teens and adults. The report addresses a common theory among anti-vaccination groups. Joining us now to talk about this and other health topics today is Dr. Jeff Pothof, UW Health's Chief Quality Officer. You know, this is putting to rest some speculation over the effects of the vaccine. Can you explain this a little bit better?
Yeah, so I think all of us remember when those mRNA vaccines first came out, there were all kinds of claims of horrible things that they caused. The problem with that is that if you give millions of people a vaccine, you can associate horrible things with people who got a vaccine, but the two may not be related. It took a couple of years, but researchers looked specifically at one claim was that it would cause the stopping of the heart of young athletes, sudden cardiac death. And they looked at over 1,300 deaths of 16 to 30-year-olds and kind of matched that up with people who had received a vaccine within 100 days of their death. And really, there is just no association between the mRNA vaccines and sudden cardiac death. What they do notice amongst folks that were unvaccinated, about 30 people died of COVID in that time period. So it just really goes to show that it's important to follow the data, the science, the math on these things, and that, you know, sometimes this perceived risk, it doesn't actually turn out to be true when the numbers are crunched.
I remember when people started talking about this right after Damar Hamlin from the Buffalo Bills collapsed on the field. I mean, all of us remember that, right? And they were able to resuscitate him and bring him back and everything like that. But that kind of got this whole theory very much back in the headlines.
Yeah, and I think what's important to do is, you know, one person who has a sudden cardiac event, you know, and had a vaccine, who knows when, doesn't mean that that vaccine caused that event. There's coincidence there, but what we really need to look for is causation, research that proves causation, or at least correlation. You know, we see a lot of people who get a vaccine, something bad's happening. We don't know if it's a vaccine or not, but lots of times these horrible stories, they are horrible stories, they're coincidence. Nothing to do with the vaccine.
Well, speaking of vaccines and something that, you know, can be prevented with a vaccine, measles has been considered eliminated from the U.S. since the year 2000, other than a few cases kind of here and there over the years. But this latest outbreak of cases is potentially threatening that elimination status. Talk to me more about this and kind of how we got here.
Yeah, so the elimination status for measles doesn't necessarily mean that there's never a case of measles in the United States, but what it really refers to is the ability of measles to kind of transmit freely in our communities. And in the year 2000, we were considered eliminated for measles, meaning that if someone traveled to a country that had lots of measles, came back with measles, you know, maybe a couple people came down with measles, but it was really easy to isolate that. As we see lower vaccination rates with the MMR vaccine, we're getting to a point where measles could come into a community and it could start to spread. We might be challenged to stop the spread because we don't have enough vaccinated people, that the measles virus always has someone else to infect and can lead to larger and larger outbreaks if we don't get a little bit higher vaccination rates with the MMR vaccine.
We'll have to wait and see if that elimination status gets revoked from the United States. Dr. Pothof, we always appreciate it. Thank you.
Good to see you.